want to invite Sharon Toker and Hadar Freidin. I hope I pronounced your name correctly. And they will talk about survival of the fittest, oldest employees' well-being.
So good afternoon. My name is Sharon Toker. I'm an associate professor at the Kohler School of Management in Tel Aviv University. And this is a joint project with Hadar Freidin, my PhD candidate. She's sitting here. And actually, it really relates to what Manuel just talked about. I think it's going to be relevant for many of you, both in Israel and for those who listen to us in the UK. Because I'm actually advocating for lowering the old age dependency ratio, which you talk about. And that's what I'm going to talk about right now. So it's survival of the fittest, and we're going to talk about older employees' well-being. And when I'm talking about older employees, they are not elders, they are not 70 or 80 years old or older, but they are 50 years old and older, or 60 years old. And I'm going to be 50 in 2 years, so this is relevant for me, and this is relevant, I guess, for many of you who are sitting here in the audience. Okay, just a minute. So we know that there are many studies that try to assess the effect of work on our well-being. And usually what these studies do, they compare those who work to those who do not, and try to assess how working affects our well-being. So work does affect our well-being in many various ways. Some are happier, some are not. For example, a recent study conducted at the Taub Center in Israel, which compared the happiness levels or the satisfaction with life levels among those who are 60 to 80 years old. Compare them between those who work and those who do not. Found that working favorably affect your well-being, but this really depends on the kind of work you do. So in one of the lectures, they talk about poor health, the opening lecture today, poor works or blue-collar works, very demanding work. So these are jobs that do not favorably affect our well-being. But many jobs do. But the problem we identified and others identified is that even if older people want to work, and again, when I'm talking about older, I'm talking about 50 years old and up, they are facing numerous challenges in the UK and in Israel. So if we look at the headlines of the media, those who are recent and those who are 10 or 20 years old, we know that it's really difficult to find a job if you're 50 years or older. And even if you find a job, your chances of finding a good job, a job that fits your capabilities, your experience, your needs, are lower. If we look at the numbers, these are numbers from the UK, we see that those who are over 50 years old, if they find themselves without a job, their chances of being unemployed over a year, these are the red bars, are much higher than those who are younger than 50, and even finding a job after 2 years is difficult again. So if you're out of the job market, it's really difficult to return. And some of the problems identified are those who relate to conceptions or to misconceptions of recruiters and of employers. So these employers or HR recruiters ask themselves, are 50 years old as effective as younger employees? Aren't they burned out? We all think of burnout as this very old person sitting and he's having a hard time at work. Can they handle work demands? Do they still have work motivation? Do they have this sparkle, this vigor? Can they learn new skills? And if we're talking about the technology divide you just mentioned, can they handle new technologies? Can they learn them? Like, God forbid, like being 60-year-old and needing to to study to learn how to use a new software, can they successfully cooperate with younger employees, or should we really put them in this home for elders? And we know that this is not necessarily true, but there aren't many studies that have tried to look at this specific age group. And this is really a recent report published in the UK about good recruitment. And again, they say that 36% of these 50 to 70-year-olds feel a disadvantage applying for jobs due to their age. So our research question, when we had several, were really related to this age group. And we asked ourselves, are 50 and 60-year-olds really more burnout as we see them or as others see them? Do they perceive the work as more stressful? Do they still enjoy working? Do they perceive their organization as less supportive? So what is going on with them? Because again, the misconception here, and I'm like giving you some of the highlights of the findings, the misconceptions are that they do, that the answers are framed in a negative way. So this study, we utilized data that I've been part of the research team that gathered it from the 2018 National Survey of Healthcare Employees. So what we've done there is survey the entire healthcare workforce in Israel. These are 62 organizations that include the entire workforce in Israel, all hospitals and all HMOs, Kupot Cholim in Hebrew. About 30% of the healthcare employees in Israel completed this survey. And the reason we've chosen to start with this data set is that it's inclusive, and it has various occupations. So, of course, there are nurses and physicians, but there are also 33% administration and maintenance employees. And these are employees who do not do any healthcare professional work. So these are the clerks, the mechanics, the cooks, etc., and of course the secretaries. And also there are 90% healthcare professions, like psychologists or lab technicians, etc. So it is really diverse, both geographically and also in terms of age. So if you look at the red numbers in this pie, so 35% of our sample included 51 or 61% or older. Okay. If we look at the number of work hours they worked, they were quite similar across ages. Their tenure, of course, was somewhat higher because they've been working more time in their organizations, and the percentage of women, again, was quite similar across these ages, somewhat lower in the older age. Okay. So what did this survey include? It included a burnout measure, which included 9 items, and 23 indicators of work characteristics. Because we had to survey tens of thousands of employees, we needed a short survey, so it's 1 item each, and you're going to see them soon. What did we find? So are these employees really more burnout, stressful, and hate their jobs? No, they don't. It's not only that they don't, but what was really fascinating is the following. So it's not elders, it's olders. Do older employees experience higher levels of burnout and stress outcomes? So these are the items. The items they were asked to complete appear at the head of the screen. So the stress I experience at work negatively affects my health. Actually, they said that it affects them to a lower extent than younger employees. And when we looked at different occupations, we saw that it's the exact same trend. So the older you are, the less you say that stress affects your health. Then we move to burnout. And this is something we find. So I'm a stress and health researcher. I study burnout. So we know that burnout decreases as you age. So this was not surprising to me. But again, we saw that across the occupations. So no matter whom we asked, yes, burnout decreases with time. But we were not only interested in burnout and stress. We wanted to know how these employees perceive their workplace. So how do they perceive their profession, their career opportunities, their pay? we found that they are more likely to say that their pay and benefits are fair, more than younger employees. They were also asked, would you choose another profession if you had an opportunity, if you could do that today? And actually they said, no, I would choose to stay in my profession much more than younger employees. Again, for all occupations, including the administration and maintenance people. We asked whether they have an opportunity to develop their professional career in their organization, and this time they were not less likely, but as much as likely as others to say that they do. But what about experiencing workload? Because we think, well, they can't handle this load at work, right? They're older. So first of all, they work similar hours, so it's not, so what I'm going to present now, it's not a matter of how many hours they work. Do they perceive their job as having too much workload? No, actually as less. Do they complain that they have too many administrative tasks? No, they don't. Do they think their physical work environment makes it difficult for them to perform their job? No, it's actually significantly lower than others. And even when we asked about physical load, like carrying, lifting, standing up for long hours, we have this conception that they can do it. Well, actually they can, and even better than younger people. And let's talk about this technology gap you just mentioned. So we asked, do you find it difficult to handle the computer systems at the hospital? We know that they are a nightmare. No, they don't. They're in a better state. What about integrating home and work duties? Will you be able to integrate your work and home duties? Of course, it's easier for them. So this was not surprising, but again, across all occupations. Then we asked about work characteristics. So do you find your job as varied and interesting? Yes, they did, more than younger employees. Do you feel you have an influence on making decisions, initiating different things? Again, results were better for them. What about social support at work and someone to turn to? Again, we did ask whether they have someone to turn to when they have concerns. So these results were similar, but not more severe than younger employees. But they did report that they feel like their colleagues can cooperate and help each other. They saw little or less tensions between different role holders in the organization. And when we finally looked at indicators of abuse, harassment, and discrimination, we saw that these employees, and again, these are 36,000 employees, yeah? So the older they are, just among nurses, the less likely they are to say that their manager harasses them, but in the other occupations, it was similar, not worse. They suffer or report suffering from less verbal violence, physical violence, and we also asked them, do you feel discriminated in terms of sex, gender, religion, race, origin? And actually they said that they were feeling less discriminated, but we did not ask about age, so age discrimination, unfortunately. I wish we would. Do you feel your organization is committed to your health? They felt that the organization is more committed. So we were really intrigued here. And then we asked whether there are differences between men and women, because there is a huge debate now about raising the retirement age. So maybe it's okay for men to work in these occupations, but not for all the women. Maybe they do feel discriminated, etc. But actually, we hardly found any differences. So nothing which was stable, or we didn't find any trend. So the experiences were quite similar. So we were really intrigued because we thought that they are not in a worse situation compared to younger employees, but we did not imagine that they would be significantly lower in all of the stressor and burnout items. We repeated this analysis and we controlled for their gender, work hours, Hadar help me, managerial position, what else? Their occupation, the work hours, and results were still really significant at a 0.000. So we also had the Bonferroni correction, so it was really stable. So then we say, well, this is not representative. This is the healthcare workforce. So we took another data set I had. I've been working for 20 years at the Ichilov Medical Center, the Tel Aviv Center, and there's a cohort study which we initiated back in 2002, and healthy or apparently healthy employees come for a day of routine examinations, and what they do is, while they have these routine health examinations, they complete a survey with physical and occupational and other indicators. So we returned to this data set, and we wanted to see whether in this data set we see the similar results. Again, the percentage of those who are 51 or 61 and older was quite similar, about a third of our sample. Again, this is a huge data set with almost 18,000 employees, very diverse in terms of occupations and blue collars and white collars, so really diverse. And what we found was, again, amazing. So yes, the older they get, they were less burnout. They perceive the workload as lower. The work vigor indicators were higher. The job satisfaction indicators were higher. When asked about having a control over one's work or whether your work is interesting, varied, meaningful, the answers were significantly higher. The only thing that was not higher was, does your supervisor support you? Well, maybe he doesn't because he wants you out of the job. So again, this was really an eye-opening experience for us because we did not expect these stable findings. And if we look at the questions we've asked, well, they are not more burnout, they are more not stressful, they are not, they do not perceive the organization as less supportive, and do they still enjoy working? I guess they do. So, you know, there are many possible explanations for these findings. Maybe it's just a cognitive dissonance resolution. So if I'm working for so many years in the organization, I will tell myself a story and say that it's all fine, but I don't think this is the matter. There's also a possibility of the healthy employee effect. So those who are more healthy and more vigor, or those who experience less burnout, are more likely to stay in the organization. So the sample we have is less representative, but still we want to keep them in their job. We don't want to take them out of these workplaces. Maybe just the light at the end of the tunnel. You know, we're approaching retirement, or 61 and older approach retirement, so they look at everything as fine because they see retirement soon. Again, I don't think this is the story, because otherwise it would be applicable for 60 years or older, but not for 50 years or older. Like, I have still many years in the university until I'll retire. So I will summarize with Darwin's statement. It is not the strongest of the species that survives, not the most intelligent that survives. It's the one that is the most adaptable to change. And I think that 50 and 60 years old have seen a thing or two in their lives, and I guess they are much more adaptable to changes, or can better face the demands that workplaces face today. And with that, I will conclude. Thank you.